If your hands tingle, your memory keeps slipping, and you feel tired no matter how much you sleep. Those three things together are not just stress, and they are not just aging. They can be the early signs of something your doctor may not have checked yet: a vitamin B12 deficiency. This is one of the most common nutrient deficiencies in adults, and it is one of the most missed. Not because it's rare, but because the symptoms look like a dozen other things. People live with this for years without ever knowing what's actually wrong. By the time a diagnosis finally comes, the nervous system may have already taken a hit. Some of that damage can be reversed. Some cannot. That gap, between catching it early and catching it late, matters more than most people realize. So let's talk about what vitamin B12 actually does in your body. Because once you understand that, the symptoms make a lot more sense. B12 does three major things. First, it helps your body make healthy red blood cells. Those cells carry oxygen from your lungs to every part of your body. When B12 is low, those cells don't form properly. They come out too big and misshapen, and they can't do their job well. Second, B12 is needed for your cells to copy their DNA. Every time a cell divides and makes a new cell, it needs B12 to do that correctly. Without it, that process breaks down. Third, and this is the big one, B12 helps build and protect the covering around your nerves. That covering is called myelin. Think of myelin like the rubber coating on a power cord. It protects the wire inside and helps the electrical signal travel cleanly from one end to the other. When B12 drops too low, that coating starts to break down. And when the coating breaks down, nerve signals start to misfire. They slow down. They get scrambled. Sometimes they stop completely. Your nerves run to your hands, your feet, your spine, and your brain. So when that covering starts to wear away, the damage can show up in all of those places. Here is something that surprises most people. Your liver stores vitamin B12, and those stores can last 2 to 5 years. That means your body can run low on B12 for a long time before you feel anything at all. There's no sudden crash. There's no obvious warning. The stores just slowly drain down, and then quietly, things start to change. Your memory feels a little foggy. You're more tired than usual, and sleep doesn't help. Your feet feel strange, maybe numb, maybe tingly. You feel a little off balance. Your mood shifts. You feel anxious or irritable, and you're not sure why. On their own, any one of those things is easy to explain away. But together, they are telling you something. Your body is running out of one of the most important vitamins it needs to keep your nervous system working. Now let's look at who is most at risk, and this might surprise you because it goes beyond just diet. B12 is found almost entirely in animal-based foods: meat, fish, eggs, and dairy. If you don't eat much of those, you are at real risk of not getting enough. Vegans and vegetarians need to supplement consistently. That part most people already know. But the bigger issue, the one that gets missed far more often, is absorption. Even if you eat plenty of B12-rich foods, your body may not be absorbing it. And here's why. Your stomach makes a protein called intrinsic factor. This protein grabs B12 in your digestive tract and carries it into your bloodstream. Without intrinsic factor, the B12 just passes through. You eat it, but your body never actually uses it. Some people lose the ability to make intrinsic factor as they get older. Others have an immune condition where the body attacks the cells that make it. That condition is called pernicious anemia, and it means no amount of B12 in the diet will be enough. The absorption pathway is broken. There are also common medications that interfere with B12 absorption. Metformin is one of the most prescribed drugs in the world for type 2 diabetes. Long-term use of metformin lowers B12 levels. Many patients on this medication are never told that. They take it for years and slowly develop a deficiency without connecting the two. Proton pump inhibitors, the acid-reducing medications used for heartburn and reflux, are another example. Your stomach acid is needed to release B12 from food in the first place. When acid levels drop too much, B12 can't be freed up to be absorbed. If you've been taking one of these medications for a long time, your B12 levels are worth checking. Adults over 50 face a natural version of the same problem. The stomach simply produces less acid with age. This is normal, but it means B12 absorption naturally becomes less efficient over time. Studies suggest that somewhere between 10 and 30% of adults over 50 have some level of B12 absorption problem. Not because of a bad diet, but because of how the aging digestive system works. Conditions like Crohn's disease, celiac disease, and gastric bypass surgery can also make absorption difficult. The effects on the nervous system are the most serious part of this deficiency, and they need to be explained clearly. When that protective covering around the nerves, the myelin, starts to break down, the first signs usually show up in the hands and feet. People notice tingling, numbness, a burning feeling. Sometimes it feels like something is touching the skin when nothing is there. Some people describe it as feeling like they're wearing socks all the time, even when they're not. That is nerve damage, and it starts small, but it gets worse the longer the deficiency continues. As things progress, the spinal cord can be affected. The part of the spinal cord that controls balance and coordination starts to deteriorate. People with this level of damage often feel unsteady when they walk, especially in the dark or when their eyes are closed. That's because they're losing the ability to sense where their body is in space, a signal that normally travels through the spinal cord. At the brain level, B12 deficiency has been linked to memory problems, poor concentration, mood changes, depression, and in serious cases, symptoms that look a lot like dementia. Research has found that people with lower B12 levels tend to lose more brain volume over time. That's not a side effect. That's measurable structural damage to the brain. So what are the warning signs to know? Constant fatigue that doesn't get better with sleep. This happens because low B12 means fewer healthy red blood cells, which means less oxygen reaching your tissues. Your body is working harder than it should just to keep up. Tingling or numbness in the hands or feet, especially on both sides at the same time. This is one of the clearest early signs of nerve involvement. A sore or swollen tongue or mouth sores that keep coming back. The cells inside your mouth divide quickly, and they feel the effects of low B12 early. Feeling short of breath or lightheaded even without much physical effort. Mood changes. Anxiety, low mood, irritability that don't seem to have a clear cause. B12 is directly involved in making the brain chemicals that regulate mood. Pale or slightly yellowish skin. This can mean red blood cells are being broken down faster than the body can replace them. And cognitive changes. Forgetting words mid-sentence, losing your train of thought, struggling to follow a conversation the way you used to. Getting tested is simple. A blood test can measure your B12 level directly. The one thing worth knowing is that the standard lab range has limits. A reading above 200 picograms per milliliter is usually marked as normal. But some people develop real neurological symptoms at levels between 200 and 400. So normal on paper doesn't always mean normal for your body. If there's any suspicion of a deficiency, 2 additional tests can help. One measures a substance called methylmalonic acid, and the other measures homocysteine. Both of these rise when B12 is too low, sometimes even before the standard B12 blood test shows anything abnormal. Asking your doctor about these tests can catch a problem earlier. If you take metformin or an acid-reducing medication long-term, or if you're over 50 and haven't had your B12 checked in a while, bring it up at your next visit. Treatment depends on what's causing the deficiency. For most people, oral supplements work well. B12 supplements come in a couple of forms. Cyanocobalamin and methylcobalamin are the 2 most common. At higher doses, your body can absorb a small amount of B12 through the lining of the mouth and gut directly, without needing intrinsic factor. This is why high-dose oral supplements can work even for some people who have absorption problems. For those who can't absorb B12 at all through the digestive system, like people with pernicious anemia, B12 injections are the answer. These go directly into the muscle, bypassing the gut entirely. Injections are often given daily or weekly at first, then monthly once levels are stable. If a medication is draining your B12, stopping the medication usually isn't the solution. Instead, supplementing B12 alongside it is the practical and safe approach. Diet also plays a role. Eggs, dairy, fish, and meat all provide solid amounts of B12. For those who don't eat animal products, fortified foods and supplements are not optional. They are essential. One thing people often ask is, once you start treatment, how quickly do you recover? The honest answer is, it depends on how long the deficiency has been there. The good news is that the nervous system can heal. Myelin can be rebuilt. Many people see real improvement in their symptoms within weeks to a few months of starting treatment. Fatigue often lifts first. Tingling and numbness take longer. But if a deficiency has been present for years, and it went undetected the entire time, Some of the nerve damage may be permanent. Not all of it, but some. That's why early detection matters. The body has a remarkable ability to recover when it's given what it needs. The earlier that happens, the more complete the recovery tends to be. Vitamin B12 deficiency is common. It is treatable. And in most cases, it is preventable. But it requires knowing what to look for. It requires understanding that a blood test result marked normal isn't always the full picture. And it requires understanding that certain medications, certain health conditions, and simply getting older can quietly drain your body's stores over time. The symptoms don't always look alarming at first. They look like fatigue. They look like getting older. They look like stress. That's exactly why so many people go years without a diagnosis. Pay attention to the signs your body is giving you. Get tested if you have any risk factors. And if something feels off, if you're tired in a way that rest doesn't fix, if your hands and feet aren't feeling the way they used to, if your memory has been slipping, don't chalk it up to age before you've ruled out something that is entirely fixable. Your nervous system works every second of every day to keep you functioning. B12 is part of the foundation that holds that up. Make sure you have enough of it. And there you have it. Take this knowledge and take control of your health. Thank you for watching.